So this video is sharing just a few tips around catheter insertion. Before you insert a catheter on a female patient, before you begin the actual physical process of doing that, make sure you're able to visualize the urethra. And that's going to involve spreading the labia, getting a flashlight, and actually shining that light and seeing if you can see the urethra. Many times I've seen nurses and students start catheterizing a female patient. They haven't adequately visualized the urethra, and it's kind of a gong show, for lack of a better term. If you do get the wrong hole, leave the catheter in and try again. That's true. But the best way to avoid all that is to ensure that you're visualizing the urethra. And it can be in different places depending on what that patient has been through in their life in terms of childbearing, in terms of surgeries. So it might not be where you think it is. So it really pays to take the time to visualize that. The second tip is something that I call glove drag. A lot of times when students put on sterile gloves, they don't fit quite right. It's better to have a glove that's too tight than too loose. Because if you have a loose glove like that, and say you're in the process of inserting a sterile catheter, say I'm in the middle of that, when my glove drags here, or drags against something, or say I'm inserting here and my glove drags against the skin, or rather I've got the labia spread and I'm pushing with this hand and this glove is touching skin, I don't know it because I can't feel it because it's so loose, then suddenly I'm contaminating my catheter. So the best way to fix that is to make sure your gloves are on really tight so that they don't touch any skin without you not knowing it. Because if they touch skin, then you know they're not sterile anymore. The third and final tip for this video is that when you get to the point where you've got urine flow and you've inserted a little bit more, before you reach down to inflate the balloon, make sure you grab the catheter with the other hand and hold it. I see students forget that all the time, and so that by the time when they don't do that and then they go to reach for their syringe, the catheter starts to move out and now it's no longer in the right place. So make sure you grab the catheter before you let go to insert the balloon. That concludes a few tips around catheterization.